Hello friends, today I will be explaining about the high resolution computer tomographic image of temporal bone and the important structure that a surgeon or an ENT resident must know. So I have an DICOM image which I got from my institution. So let us start without any delay. So I'll start from cranial to caudal direction. This is the cranial cavity and this is the frontal sinus. This is the frontal sinus. As we descend down, you will start seeing the pneumatized bone over the temporal part on the temporal bone, and this pneumatized part is called the mastoid. These are the mastoid pneumatization here. Okay, temporal bone consists of four parts basically: the mastoid, the petrous, the squamous, and the styloid. So the first pneumatization seen on the temporal bone is the mastoid air cells, and followed by that you will get the petrous part. Okay, so as you come from top to bottom or the cranial to caudal direction, you can see as you come from cranial to caudal direction, you can see a small tick-like structure. This is the arc formed by the superior semicircular canal. So since it is a canal, it's a hollow structure. That is why you are seeing a shadow over here. And this canal come and join towards the vestibule and the next structure, and that is why you are seeing the two cut end of the canal, or the sectioned end of the canal of the same superior semicircular canal. As you descend down, you can see that it is joining into the vestibule, and at the joining area another canal arises to the lateral direction, and that will be the lateral semicircular canal. This is the vestibule, this is the lateral semicircular canal. Okay, so the first structure from craniocaudal direction that you see is the vestibule and the superior and lateral semicircular canal. Okay, the second important structure that you see is the internal auditory canal, where it carries the facial nerve as well as the vestibulocochlear nerve. Okay, now the facial nerve and the vestibulocochlear nerve travel through the internal auditory canal, and it gives one tick to the vestibule, one tick to the cochlear side. Basically I didn't mention about the cochlea here. I'll tell you about where is the cochlea. This is the cochlea. Okay, so one tick will be going to the cochlea, one tick will be going to the vestibule. Okay, and now the question is, where is the facial nerve? Okay, so in the internal auditory canal there is another tick that is going anteriorly, a small tick that you can see here. I'll zoom a little bit so that you can see that. A small tick that you can see here. In the opposite ear you can see very clearly a small tick that you can see going anteriorly is the labyrinthine segment of facial nerve. Let us come back. So the small tick that you are seeing here is the labyrinthine segment of the facial nerve. Now this labyrinthine segment will be continuing into a horizontal segment. Now where is the horizontal segment? As you go down, this is the labyrinthine segment. As you go down, this is the first genu, and from the first genu another segment arises. This is the horizontal segment, and it will go to the posterior direction. Okay, in the posterior direction, and it goes posteriorly up to the mastoid antrum, and then it forms a canal over here. A small foramen over here that's using the mastoid antrum. This actually harbors the facial nerve, and this is the vertical segment of the facial nerve which exits through the stylomastoid foramen. Okay, which exits through the stylomastoid foramen. So now you know the entire course of the facial nerve. Now I repeat once again: the small tick with the horizontal labyrinthine segment, then the first genu, then it goes back, then it forms the second genu where it forms a vertical segment. okay, where it forms the vertical segment. Okay, now let us come back again to the cranial to caudal direction. I'll zoom out a little bit. Okay, now you can see an this cochlea which appears like a clover leaf. Okay, this is the basal turn, this is the apical turn. And one more thing that I want to mention, in the cochlea there is another, basically there is a small shadow that arises. Okay, there's in this CT scan it's not that much clear, but in some certain CT scan it is very clear that uh, a small shadow after the internal auditory canal, a small twig like shadow that connects the basal turn of cochlea, or that connects the cochlea, and that shadow is also called the uh, cochlear aqueduct. Now let us see the posterior semicircular canal. This is the posterior semicircular canal. Okay, when you come from cranial to caudal direction, after the signet ring there is another twig that you see, that is the posterior semicircular canal. So these are the main structure that you see in the middle ear. Now what is this structure? This structure is the carotid artery. Basically this is the carotid artery. Okay, the carotid artery coming from the carotid canal. Okay, now let us move on to the middle ear, the most important structures that I will show you in the middle ear. Okay, when you come down you will see the epitympanum. Epitympanum is actually middle ear is divided into three parts, from superior to inferiorly: epitympanum, mesotympanum and hypotympanum. Okay, the one that you are seeing above is the epitympanic part. From when you come from caudal to cranial direction, cranial to caudal direction, the epitympanic part that you see. Then you will see the small this piece of bone inside the medullary cavity. Now what is this? It's actually, these are two different bones. This head, like this, appears like a ice cream cone, and the ice cream part, that is the this part is the head of the malleus, and the cone part is the body of the incus. Okay, now this ice cream cone, okay, now in the middle ear there is a connection towards anteriorly. Okay, this is the eustachian tube that it forms. Okay, now in this middle ear let us see the posterior part coming from the superior to inferior. After the ice cream cone you see some depression near the, okay, now this is the basal turn of cochlea, and this projection that is projecting toward in the middle ear, in the on the medial side, is the promontory, and this depression that you see is the sinus tympani, and the elevation follow after, just lateral to the sinus tympani, this elevation that you see, is basically the pyramid, and after this elevation you see another depression, and that is the facial recess. So between the pyramid and the facial recess you might get the vertical segment of the facial nerve that I have already shown you. Okay, which I have already shown you that the vertical segment will come on the mastoidantrum. Now you know this is the sinus tympani, this is the pyramid, the facial recess. Now this is the stapedius, sorry, this is the stapes bone. This is the stapes bone that is connected towards the middle ear. Now from the pyramid there is a muscle arises that is attached to the stapes, and that is the stapedius muscle. Okay, now let us see the external ear. Okay, as we come down you can see the pinna that is, okay, the pinna that you can see, and from the pinna there's some soft tissue is over here. Let us see in the opposite side. Let us see what we can see in the opposite side. The pinna going into the middle ear. Okay, now the structure that you see, this structure that you see is the uh, tympanic membrane. Okay, this is the tympanic membrane. This is the umbo of the tympanic membrane. Okay, then you find the ice cream cone and all as you go superiorly. I'm going in the superior direction. Okay, hope you understood some of the important structures in the high resolution computer tomography of the temporal bone.